Hello, this is a video lesson on anatomy of the urinary system. To start with, the urinary system includes two kidneys, two ureters, the urinary bladder, and one urethra, and is often called the excretory system. The kidneys are bean-shaped bodies. They have a convex lateral border and a concave medial border. They're 4.5 inches long, 2 to 3 inches wide, and 1.25 inches thick. The left kidney is slightly longer and more narrow. The kidneys are located retroperitoneal, which means that they're in contact with the posterior abdominal wall. The superior aspect is more posterior than the inferior, and that means they lie in an oblique plane. Now that plane is approximately 30 degrees anteriorly toward the aorta. The kidneys extend from about T12 to L3, and the right kidney is slightly lower than the left. The function of the kidneys is to remove waste products from blood, to maintain fluid and electrolyte balance, and secrete substances that affect blood pressure. The kidneys normally secrete 1 to 2 liters of urine per day. I took the cross-sectional view of the kidneys and turned it up to a 30-degree oblique to show something. And want to point out that with an AP oblique projection, if you were to have the right side up, in other words, the right kidney is elevated, it's going to orient that upper kidney so it is parallel to the image receptor. If the image receptor is down here, it'll be parallel to it. On the other hand, the dependent kidney, which is the side down, would be almost perpendicular with the image receptor plane. So on the dependent kidney, it would show the anterior and posterior surfaces. Another part with kidneys is to examine more in depth about them. So we want to look at the renal capsule, which is the first part, the outer covering. Secondly is the renal cortex. That's the outer layer of the renal tissue. There's the renal medulla, which is the inner layer of renal tissue. It composed of 8 to 15 cone-shaped segments of collecting tubules that are called renal pyramids. And here's the renal pyramids. There are renal columns, which are extensions of the cortex between the renal pyramids too. Now, the nephron is an essential microscopic parenchyma of the kidney. There's approximately 1 million nephrons per kidney, and it consists of the renal corpuscle. The renal corpuscle has both the glomerular capsule, which is called the Bowman's capsule. There it is right here. And then the glomerulus itself is the cluster of blood capillaries. And then there's the renal tubule. The glomerulus is formed by the tiny branch of the renal artery entering the capsule and dividing into capillaries. There's an afferent arteriole, which is the vessel entering the capsule, and there's the efferent arteriole, which is the vessel exiting the capsule. The glomerulus is a filter for blood, allowing fine particles and water to pass into the capsule. The renal tubule is continuous with the capsule. There's a proximal convoluted tubule, the nephron loop, otherwise called the loop of Henle, and then the distal convoluted tubule as well. The distal convoluted tubule opens into the collecting duct, which is down here. So the collecting ducts form a central tubule within the pyramid. They open at the renal papilla and drain into the minor calyces. So the calyces are the cup-shaped stems that enclose one or more papilla. The minor calyces, there's 4 to 13 of them that unite to form the major calyces. And then the major calyces, which there are 2 to 3 of them, are going to unite to form the renal pelvis, which is this last part. The renal pelvis is the expanded funnel shape, and it's at the UPJ, which is the ureteral-pelvic junction. And that's the area where the renal pelvis is going to transition into the ureter. The renal pelvis is continuous with the ureter. Now the hilum is the area over here. It's a longitudinal slit in the medial border for transmission of blood vessels, nerves, lymphatic vessels, and the ureter. There are two ureters. They're 10 to 12 inches in length. On the proximal end, they are going to extend from the renal pelvis. On the distal end, they're going to enter the posterior lateral surface of the bladder. They convey urine from the renal pelvis to the bladder via peristaltic contractions. The urinary bladder is a musculomembranous sac and is a reservoir for urine. It's located immediately posterior and superior to the pubic symphysis. It's anterior to the rectum in males and anterior to the vaginal canal in females. It can hold 500 milliliters when completely full. The urge for micturition occurs at 250 milliliters. The trigone is a triangular area of the bladder base between three openings. There are the urethral openings, which are shown here, and then the internal urethral orifice. The urethra conveys urine to the exterior of the body. It's a narrow musculomembranous tube with a sphincter that's at the neck of the bladder, and it's approximately 1.5 inches in females. The urethra, the male urethra, is 7 to 8 inches in length. There's the prostatic portion, which is 1 inch, and it reaches from the bladder to the floor of the pelvis. It is surrounded by the prostate. The second portion is the membranous portion, and it's 1/2 inch, and it passes through the urogenital diaphragm. The third part is the spongy portion, which is called the spongy urethra. It passes through the shaft of the penis and ends at the external urethral orifice. The small glandular body surrounding the proximal part of the male urethra is called the prostate. It is considered the part of the male reproductive system. It measures approximately 1.5 inches transversely and 3/4 at its base and 1 inch long. The suprarenal glands are also called adrenal glands. They're ductless endocrine glands. They have a flattened body. There's the medullary portion, which is internal, and the cortical, which is external. They produce epinephrine, which is secreted by the medulla, and the cortical hormones are secreted by the cortex. On the left-hand side is a kidney scan without contrast, just looking at how the kidneys appear, kind of like a medium gray color without any contrast. And on the right-hand side, this is another scan without contrast. And the purpose was to show that you can see on here, very little, tiny little speck, that there's a renal calculus in the left distal ureter. And this concludes our lesson on the anatomy of the urinary system.